Did you know that the medications you take every day could be harming your memory? It sounds absurd, doesn't it? But science is revealing alarming connections between common medications and the development of dementia. Today, we're going to discover 10 popular medications that recent studies have linked to cognitive decline. Get ready, because medication number 10 is going to completely surprise you. Stay until the end, because this information could change your life. Let's get started. Medication number 1, proton pump inhibitors. How many of you have rushed to the pharmacy to buy omeprazole when heartburn hit? These medications, called proton pump inhibitors, are among the best-selling in Brazil. Omeprazole, esomeprazole, pantoprazole, lansoprazole, names that are part of the daily lives of millions of Brazilians. But here's what nobody tells you. They do much more than just reduce stomach acidity. The mechanism is complex and concerning. When you block stomach acid production for months or years, you dramatically interfere with nutrient absorption, which are essential for the brain. Vitamin B12, for example, needs acidity to be released from food and absorbed. Without it, your neurons literally run out of fuel. Magnesium, another vital nutrient for brain function, is also absorbed less effectively. It's like trying to make a car run without proper gasoline. A German study followed more than 73,000 people for 5 years. The result was shocking. There is a 44% higher risk of dementia in those who use these medications for more than 4 consecutive years. 44%. That means almost a 50% greater chance of losing your memory. A practical tip that can help protect your brain. Talk to your doctor about alternatives, like changes in your diet, avoiding trigger foods, eating at regular times, or using less potent antacids only when necessary. Medication number 2, statins. Now, a direct question that I want you to answer mentally. Do you take medication for cholesterol? If the answer is yes, pay close attention. Statins like atorvastatin, simvastatin, rosuvastatin are life-saving medications that prevent heart attacks and strokes. That's undeniable. But there is a dark side that few doctors talk about. Cholesterol is not just a villain. It is essential for the formation of the brain's cell membranes. When you drastically reduce its production, you may be interfering with communication between neurons. In addition, statins block the production of coenzyme Q10, a substance vital for energy production in brain cells. Many patients report brain fog, difficulty concentrating, and memory problems soon after starting treatment. A study with more than 300,000 American veterans showed a 9% increase in the risk of dementia. Other studies show similar results. What do you do with high-risk patients? The point here is not to demonize statins, but to find balance. There are cases where small doses are enough, or where lifestyle changes can reduce the need for medication. What should you do? Never stop on your own. Discuss with your cardiologist whether the benefits outweigh the risks in your specific case. Medication number 3, benzodiazepines. Raise your hand mentally if you've ever taken Rivotril, diazepam, lorazepam, or clonazepam. These tranquilizers are incredibly effective for anxiety, panic disorder, and insomnia, providing almost immediate relief, but they hide a silent danger that develops over the years. Here's a fact that's going to scare you. A French study followed more than 1,000 elderly people for 15 years. Devastating result. Those who used benzodiazepines regularly had a 60% higher chance of developing dementia. 60%. To help you understand the magnitude, if in a city 100 people would naturally develop dementia, among benzodiazepine users, it would be 160 people. The mechanism is cruel. These medications work by enhancing GABA, a neurotransmitter that calms the brain. The problem is that prolonged use can cause permanent changes in brain receptors, impairing the formation of new memories and the consolidation of existing ones. The worrying thing is that many people use these medications for years without knowing the risks. Physical and psychological dependence develops quickly, making it hard to stop even when you want to. There is hope. Cognitive behavioral therapies, relaxation techniques, breathing exercises, and even meditation apps can be just as effective as medication in many cases. It's worth exploring these alternatives with a specialist before it's too late. Medication number 4. Opioid painkillers. Chronic pain is suffering that no one should underestimate. Opioids like morphine, oxycodone, tramadol, and codeine offer powerful relief when the pain becomes unbearable. But did you know they can literally shrink your brain? MRI studies show something terrifying: a progressive reduction of gray matter in areas related to memory, decision-making, and emotional control. We're not talking about subtle changes, but visible alterations on imaging exams. Patients who use them for months or years have a significantly higher risk of cognitive decline. A study published in the Annals of Internal Medicine followed thousands of patients and found a clear correlation between prolonged opioid use and the development of dementia. The mechanism is twofold. In addition to the direct effects on the brain, opioids cause excessive drowsiness, reduce physical activity, and can lead to social isolation, all factors that accelerate cognitive decline. The good news is that there are revolutionary alternative treatments: specialized physical therapy, acupuncture, anesthetic blocks, electrical stimulation, psychological therapies for pain, and even virtual reality for distraction. Don't give up on quality of life, but explore all options before accepting the cognitive risk. Medication number 5. Anticholinergics. This complicated name hides medications that you probably have at home right now: Dramamine for nausea, Benadryl for allergies, some over-the-counter antihistamines, and medications for overactive bladder like oxybutynin. The mechanism of action is direct and scary. They block acetylcholine, which is literally the neurotransmitter for memory and learning. It's like cutting off the brain's internet, disrupting communication between neurons in areas essential for forming and retrieving memories. A monumental study from the University of Washington followed 3,400 adults for 7 years. The results were devastating. High doses of anticholinergics increased the risk of dementia by 54%. And we're not talking about absurd doses. Many people reach these levels using common over-the-counter medications. The most concerning thing is that many of these medications are sold without a prescription. People take them on their own, without knowing they're putting their memory at risk. Antihistamines for allergies, motion sickness medications, sleeping pills, they can all contain anticholinergic substances. A smart alternative that can save your mind. For allergies, prefer nasal sprays with corticosteroids that act locally. For nausea, try ginger, acupressure wristbands, or more modern medications without anticholinergic effects. Medication number 6, tricyclic antidepressants. Amitriptyline, nortriptyline, imipramine, clomipramine. These older antidepressants are still widely prescribed, especially for chronic pain, fibromyalgia, migraine, and depression that is resistant to more modern treatments. The problem is twofold and cruel. In addition to altering neurotransmitters to treat depression, they also have a potent anticholinergic effect. It's like using a hammer to do the job of a scalpel, effective but with significant side effects. An impressive analysis of data from Indiana University on 400,000 patients showed a clearly increased risk of dementia, especially with high doses and prolonged use. The risk increases progressively. 3 months of use, low risk. A year, moderate risk. Several years, high risk. Tricyclic antidepressants also affect other systems. They cause dry mouth, constipation, blurred vision, dizziness, and weight gain. These effects can create a vicious cycle where the person feels worse, not better. Newer antidepressants, such as selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, can be much safer options with similar effectiveness. Talk to your psychiatrist about a possible gradual and monitored transition. Medication number 7, antipsychotics. Haloperidol, risperidone, quetiapine, or olanzapine. Essential medications for schizophrenia, bipolar disorder, and some cases of severe depression, but which require strict monitoring. They work by blocking dopamine receptors in the brain, controlling psychotic symptoms such as hallucinations and delusions. The problem is that dopamine is also essential for cognitive functions, movement, and motivation. Neuroimaging studies show that prolonged use can cause structural changes in the brain, including reduced brain volume and changes in connectivity between different regions. A study in the British Medical Journal showed an increased risk of dementia in elderly people, even with doses considered low. Antipsychotics also cause other concerning effects: significant weight gain, diabetes, heart problems, and late-onset involuntary movements that can be permanent. If you use these medications, keep regular, closely monitored appointments with your psychiatrist. Sometimes, it is possible to gradually reduce doses, switch to more modern versions with fewer cognitive effects, or combine with psychological therapies to reduce dependence on the medication. Medication number 8, hormonal contraceptives. Here's a surprise that could impact millions of women. Birth control pills, especially those combined with estrogen and progesterone, can affect cognition in the long term. Natural sex hormones, especially estrogen, have a powerful neuroprotective effect. They stimulate the growth of connections between neurons, improve cerebral blood flow, and protect against inflammation. When you artificially alter these levels for years or decades, there can be unexpected consequences. Studies show a small but consistent decline in some aspects of verbal memory and spatial skills with prolonged use. A study followed women for 20 years and found subtle but measurable differences in cognitive function. The synthetic estrogen in contraceptives is not identical to the natural one produced by the body. This molecular difference may explain why the natural protective effects do not manifest in the same way. Safe and effective alternatives exist. The copper IUD, which lasts 10 years, barrier methods like the diaphragm, body awareness methods, or, for those who have already had children, permanent methods. Each woman should carefully weigh the risks and benefits with her gynecologist. Medication number 9, H2 blockers. Ranitidine, cimetidine, famotidine, medications used for ulcers and reflux before proton pump inhibitors became popular, but which are still frequently prescribed. They work by blocking specific receptors in the stomach, reducing acid production. The problem is similar to proton pump inhibitors, but with a different mechanism. They reduce acidity so much that they dramatically impair the absorption of essential brain nutrients. A study with more than 1,000 elderly people showed a significantly higher risk of dementia with regular use over prolonged periods. Vitamin B12 deficiency and other nutrient deficiencies develop gradually, causing neurological damage that can be irreversible. Since many gastric problems have an emotional component and are related to lifestyle, it's worth investing heavily in proper nutrition, stress management, regular meal times, and relaxation techniques before resorting to medications that can harm your mind. Medication number 10, antiepileptics. And we've reached the most surprising one of all. Phenytoin, valproic acid, carbamazepine, lamotrigine, absolutely essential medications to control epilepsy, but with a hidden cognitive cost that few people know about. They work by stabilizing brain electrical activity, preventing the abnormal discharges that cause seizures. The problem is that they also interfere with normal communication between neurons, affecting learning and memory processes. A study published in the prestigious journal Neurology followed epileptic patients for decades and showed a clearly increased risk of dementia, especially with high doses and combinations of multiple anti-epileptic drugs. The risk increases progressively over time. But here is a complex issue. Epilepsy, when uncontrolled, is infinitely more dangerous than the risk of dementia. Seizures can cause sudden death, serious accidents, and immediate brain damage. Never ever stop these medications on your own. Always remember, this information does not replace a consultation with a specialist. Never stop prescribed medications without close professional guidance. The goal is to inform you so that you can have more productive and informed conversations with your doctors, making conscious choices about your health. We've reached the end of another video that can literally save your memory and protect your brain. If this information was useful to you, don't forget to give the video a like. This really helps the channel grow and reach more people who need to know this vital information. Subscribe to the channel and turn on the notification bell so you don't miss any health content that could transform your life. Share this video with your family, friends, and loved ones, because knowledge about health is the best gift we can give to those we love. Leave in the comments which medication surprised you the most and if you have any questions about the topic. I read all the comments and always reply when I can. Thank you very much for watching until now and for trusting our channel to help you take care of your health. I wish you good health, prosperity, and a memory that always stays sharp. See you in the next video and take good care of yourself.